Good morning, everybody. Great to see you all. I'm Dr. Evan Lipson with the Melanoma and Skin Cancer Program at Johns Hopkins. So it's great to be here for this first, what I hope will be not the only event, co-sponsored by AIM at Melanoma and the Johns Hopkins Melanoma and Skin Cancer Program. So thanks to everybody joining in person and everyone joining online. I just want to give you a brief overview of us as a team. We are the Melanoma Skin Cancer Program here at Hopkins. And there are a lot of us, as you can see on the screen here. There are actually multiple of us that are not photographed, but we are a big. Am I doing wrong? There we go. We are a big group. We are dermatologists, pathologists, surgeons, med-oncs, radiation oncologists, radiologists, pharmacists, nurses, navigators, research coordinators, social workers, therapists. The list goes on and on and on. We are a big group. We all work together. We have 3 general missions. The first one is to provide world-class patient care for patients with melanoma and skin cancers, support them and their families. Second is to discover. Part of what we do is research to understand what's done to better understand disease, better help patients and their families. There we are. And the third is to teach the next generation. So we realize that the foundations that we are laying are going to be built upon by the generations that come after us. And so we are teaching the folks coming up behind us for that reason. So I'm going to tell you a little bit about each one of those. So how do we provide world-class patient care? Well, we see several hundred new patients every year. And when we see a new patient, we discuss that patient's care with the entire group. So we review everyone's case as a team, and we come up with a consensus recommendation. Sometimes those consensus recommendations are informed by research studies that have been published from international collaborators. Sometimes those are based on experiences that we ourselves as experts have had. Sometimes we recommend standard therapies. Sometimes we recommend that patients engage in experimental studies, clinical trials, to try to move the science forward. We make every effort to provide holistic care. That means we have colleagues in rehabilitation and nutrition and social work and counseling. We make every effort to make sure that the patient is cared for as well as their loved ones who are supporting them. We have financial counselors in this world of financial uncertainty. That's important. We provide language interpretation. We provide telemedicine options so that patients don't have to travel back and forth to our campus every time. We also try to share care with local clinicians when we can. So if somebody needs to be evaluated from a colleague of ours who works in the community, we try to make that happen. And so that everybody's on the same page, we share information as best we can. Let me tell you a bit about discovery. What does discovery mean? It means understanding on a very basic level why cancer forms, how it develops. We develop more effective methods of preventing cancer from forming. We'd love to put ourselves out of business if we could. That's a challenge. We're developing techniques to detect cancer as early as possible. In general, the earlier you detect the cancer, the more likely it is you can make it go away and never come back. We'd like to develop ways to predict how a cancer might behave to be able to help patients. What's your future going to look like? We spend a lot of time and energy developing more effective and less toxic therapies. Sometimes those are medicines, sometimes those are surgeries, operations, radiation therapies, et cetera, et cetera. And we're also looking to develop methods to connect more people with high quality care. We're fortunate to live here in the Baltimore, DC area where there's a lot going on in the medical space. Patients who live 3 and 4 hours from us are not quite as fortunate. We're really trying to help everybody out there access high quality care. How does that work from a laboratory to a clinic standpoint? We have a lot of translation that goes back and forth, and we'll tell you about that in a little bit. What we discover in clinic, we apply to what we're learning in the laboratory and vice versa. Some of the discoveries that have been made at Hopkins are now being used in clinic to help patients fight cancer. What's happened in the last 20 years based on some of the research that we have done here at Hopkins? Well, a lot has been developed. Back in 2005, 20 years ago, the list of medications we were using to treat patients with melanoma was very, very short. There it is on the left. There really were only 3 agents we were using. In 2025, that list is much, much longer. So lots and lots of research has gone into improving the care of patients with melanoma and non-melanoma skin cancers. What does that mean in terms of outcomes? Great question. Glad you asked. Here's what that means. In 2005, the likelihood that somebody was going to be around 5 years after being diagnosed with metastatic melanoma was about 10%. That same statistic in 2025 has increased 5-fold. That likelihood is now about 50%. So is that great? It sure is. Do we have a lot of work yet to do? We sure do. Lastly, we want to teach the next generation. So we want to inspire and train and mentor outstanding, bright, engaging future leaders that are going to help take the baton and continue to do the research and patient care that I was talking about. That includes basic laboratory science. That includes animal models to understand how disease works. That includes clinical trials that are developing cutting-edge therapies for patients to provide excellent patient care. So that's what we're up to. There's the big group of us from a few years ago, all looking very proud of the accomplishments we've made.